So today we're going to talk a little bit about why your back pain actually could be coming from your hip. Now, you've heard me talk many a times. There's so many different sources to back pain. We've talked about issues within the back. We've talked about issues within the thoracic spine. But today we're going to talk about issues in the hip. The hip is a common source to back pain. Now, your back can also refer to your hip as well. And you have to kind of figure out, well, which one is it? But here's why the hip can create issues for the back. So if we think of like, this is our hip joint, it moves through here. And when we don't have full motion in the hip, what happens is it takes the back. So this would be my back. And it doesn't have full motion, it's gonna take the back. So the back is gonna take the load, mostly because the hip doesn't have its full mobility. And that is a problem. And that creates a lot of stress on the back that it's not normally used to taking. So that's how the hip can create some of these issues. We often find that there's a combo of back and hip. Now, sometimes the hip is the root cause of it, and then we get to the back, and sometimes the back is the root cause of the hip, and whatever's left over in the hip, we address that. But we see so many cases of back pain that are actually caused by the hip. We've had cases where clients, have had back pain for 10 years, and all these imaging, everything was looking at the back. And we started asking questions like, oh, this will be interesting. I mean, she's either going to be a lateral of the back, which the way she walked clearly could have been that way, or maybe it's her hip. And what we found was that it was her hip. Her hip was actually causing her back pain. It did not move at all. Eventually, she needed total hip replacement, but for 10 years, everyone said, nope, it's back, nope, it's back. And really her back pain was coming from her hip. She was having some hip pain, but she was having a lot more back pain. And it was just because there wasn't enough mobility in that hip. Then she was getting it all from the back. So again, we have a lot of cases that people miss because they go directly to the side of the pain and they don't really evaluate everything. So how can we tell if there's hip involvement? Well, there's some differences between a hip involvement creating some of the pain versus a back involvement. So a lot of times with our back, not every time, but a big chunk of the times, you'll notice that sitting will make you worse. And then if you get up and you start moving around, you start walking, you actually feel a lot better. Very, very common. Not common for all the backs, but a common for a big chunk of the back. Well, if you have a hip component, you typically feel worse with sitting because the hip is in a bent position, and you feel worse with walking. You don't feel better with walking. And that starts giving us clues as to, there might be a hip component in here. Not always the case, but it starts making us think. Now, we also should have limited range of motion in the hip. Almost always there'll be some sort of limited range of motion in that hip. Now, limited range of motion alone in the hip does not make me think that, oh, this is going to be a back component. But it's when you piece that with a lot of other information, it definitely is a component that we look at. So what do I mean by limited hip range of motion? Well, a lot of times, figure 4, they'll notice that one side can go down a lot farther and then the side that's hurting doesn't move as well. That's a common thing. That's limited hip motion. They may notice that when they lie on their back, one knee can come really far and the other knee only comes just by a little bit. Maybe, they notice that when they're stretching that they can't move one hip back as far as the other hip. So that's what we mean by limited hip range of motion. Now, you can have limited hip range of motion and it comes from the back. You treat the back, the hip will basically improve immediately. So just limited hip range of motion alone doesn't make us think that, oh, maybe this is a hip component and that's causing the back pain. Now, the last thing is when we're looking at their range of motion and how they move, a big sign, a lot of times when people, we're looking to see how the back moves, how the hip moves, but a lot of times we'll see people that are moving and when they extend backwards, you can see when I extend backwards how my hips want to come forward. When people have issues in their hip, they'll kind of look like this and they don't want to bring it forward, or they'll bring one of them forward so they can move on this one, but they can't move on this one. So I can show you this way. If I'm here angled, they'll kind of rotate a little bit. So they'll get some motion through here, but they won't get the same motion through one of the hips. And again, when you took that with limited range of motion, the way they stand and extend, and sitting and walking being a problem, is when you look at all of that, you're kind of thinking, there may be a hip component. But really, ultimately, you've got to get to someone that understands the body, because there's been times that people have all of that and it's a back problem and the back was causing the hip. But there's people that have those symptoms for the most part, and the hip is a major contributor. So when we look at the evaluation and ask questions and see, like, we can do some back mobilizations, we'll always clear the back. Always clear the back first. We'll go in and do some things to get those joints moving, retest the baselines, and then go back to see, did that improve the hip? Did that improve the back? Did that improve the symptoms? And sometimes we'll go through back mobilizations and it clears everything up. But once we go through that and we don't see anything, we'll move on to the hip. And that's how we also know that your hip is a big component, or their hip just literally does not move at all, but their back moves pretty well and you can mobilize the back and they don't feel anything. We'll go directly to that hip. But it takes really coming to someone that understands all these pieces. But this will give you some ideas to, let me think about this. Let me see if I can go to someone and figure out, like, is this really coming from my hip or is it coming from my back, where you might be able to help direct your care a little bit better to really get down to the source of what truly is going on. Again, my name is Stephanie. If you like our content, make sure you subscribe to our channel. In the description, we have other resources on back pain, back and hip pain, that you can look at. Other videos, as well as free resources on back pain that you can look at and do that's more than this. So make sure you check that out. We also have my book that came out last year. Super excited about that. Gotten some rave reviews on it. We have the link to that as well. And there's definitely a lot of sections on there on back and hip, and just taking you through all the different scenarios that are, as well as resources that you can pull up from the QR codes in the book. So make sure you subscribe and like, and we'll see you next time.